Hello, I'm Dr. Henry Rosenberg, the President of the Malignant Hypothermia Association of the United States. Where there is a convincing case that the patient experienced malignant hypothermia, we refer the caller to the North American Malignant Hypothermia Registry to collect more specific and detailed information about the course of the anesthetic. The registry is physically located at the University of Florida in Gainesville, where it moved from the University of Pittsburgh several years ago. There are now over 3,000 entries in the registry, comprising many cases of malignant hypothermia or situations that resemble malignant hypothermia. At the present time, the registry does not collect or analyze the hotline calls, however. They're two distinct entities. Hopefully in the future, they will be drawn together a little bit more closely. In order to assure quality of the recommendations, the Quality Assurance Committee was impaneled, who reviews many of the calls and the advice that were given. The hotline has served not only to help the clinicians and patients, but also as a rich source of information for the presentation of malignant hypothermia. We share the information from the hotline with members of the anesthesia community. Often there are presentations at national meetings of anesthesiologists, of nurse anesthetists, operating room nurses, and we make this information freely available. Some of the things that we learned from the hotline calls is that malignant hypothermia, even though managed acutely with success, unless the patient is continued on dantrolene for a period of 24 to 36 hours, the syndrome may recrudesce. And that's why we recommend that the patient be monitored in an intensive care unit. We also learned that malignant hypothermia can occur in any situation, not only in the operating room, but sometimes in the endoscopy units, wherever anesthesia may be administered, wherever the trigger anesthetic agents might be administered. The patients, when they recover, usually recover completely, but some patients develop muscle cramps that bother them for some period of time afterwards. And in some cases, muscle breakdown, known as rhabdomyolysis, occurs. We still have a lot to learn about the syndrome. Who is at risk? How best to treat the acute case? How best to manage the case after the patient is recovered from the acute episode? What to advise the patient? How do we assess the susceptibility to malignant hypothermia in family members? In future video blogs, I will attempt to address some of those topics. So the slideshow, as I said, will show you some of the nuts and bolts of how the hotline works, some of the successes of the hotline, and how it continues to grow and expand. I'd also like to remind you that this hotline, although we do not charge money either to the clinician or to the institution from which they call, because we felt that would not be in the best interest of good patient care, nevertheless, money and resources are required to maintain the hotline. And in fact, the organization is charged a small amount of money for each call that is connected to a hotline consultant. None of the consultants are paid for their services. Generous support from for the hotline comes from a number of different places, including those who are members of MHAUS, various commercial organizations, the American Society of Anesthesiologists, the American Association of Nurse Anesthetists, just to name a few. But nevertheless, for a not-for-profit, it's always a struggle to bring in revenue to support the activities of the organization. So I'd like to thank you for listening. Thank you in advance for the support that you give MHAUS, whether it's for the hotline or for other services. And if you have any comments or suggestions, please feel free to transmit them to the organization. You may write to Gloria Artist at gloria@mhaus.org or Diane@mhaus.org. So thank you again for your attention.